Welcome to my presentation on the identification of mental health issues in older adults. This presentation discusses the under-recognition of mental health conditions in the elderly population. It will briefly discuss the societal and personal factors that contribute to this under-recognition and explore evidence-based strategies that help professionals can use to lessen the impact of this under-recognition and promote the overall health outcomes of older adults. According to Shan et al. 2024, 14% of persons 60 and older globally suffer from mental health disorders, making mental health disorders a source of public health concern. However, many older persons' mental health issues remain undiagnosed and untreated. The following are only but a few variables that lead to older individuals' mental health problems being unidentified. Individual factors. Research indicates that most older adults and their families perceive mental illness as a normal part of the aging process. In a recent Australian study involving 60 older individuals with mental health issues, half of the participants believed that their symptoms of anxiety and depression were typical for their age group. Also, a study done by Volkert et al. Shows that older people believe that seeking outside help was insignificant and that overcoming mental illness like depression was an internal personal duty. Some cultural factors that affect this under-recognition also include the fact that older people view mental illness as a sign of weakness and are unlikely to admit experiencing problems, especially when they fear a loss of independence. Other societal factors include lack of financial resources, prejudice, and discriminations that come from public stigma. One of the main effects of public stigma is that older people who may benefit from professional assistance are often reluctant to tell others about their symptoms, including their physicians, because they are experiencing feelings of despair, hopelessness, and humiliation. There is also a lack of age-appropriate and readily available services, as well as a lack of professionals who are skilled in identifying and assessing mental health issues in older adults. Most et al. 2017 shows that there is greater emphasis placed on the biological way of treating than on the holistic and integrated model that considers the overall person, the physical, mental, and emotional well-being of the individual. We will now consider evidence-based approaches to alleviate the effects of under-identification on the mental health and general well-being of the older adult. The first one is elimination of stigma. The stigma surrounding mental health can be reduced or even eradicated if health providers engage in intentional and meaningful conversations about the mental well-being of older patients during routine health discussions, especially when addressing essential support, care, and treatment options, according to Koisa et al. 2023. Compared to the growing number of older persons, the geriatric mental health force is seeing an exponential drop. To improve geriatric care, hiring and training of professionals to deliver multi-level interventions that are developmentally appropriate, culturally competent, holistic, recovery and strength-based is very important. Community outreach programs is another strategy. These initiatives address more general concerns such as socioeconomic determinants of health, which include housing, work, education, and poverty. These strategies, which are frequently person-centered and recovery-oriented, encourage community involvement and social connectivity, lessening the stigma and isolation, linking people to care early in their mental health recovery, and in the end, lessening the burden that mental health places on individuals and the society at large. Improved social support network is also important, as psychosocial support for senior citizens should involve assisting older people in accepting new limitations, exploring different directions, and navigating the grief process for loss and significant life changes. Enhancing mental health assessments is also important to facilitate the diagnosis of these mental health issues. In conclusion, it is undeniable that our senior citizens face numerous mental health issues. A multimodal strategy is needed to help older persons achieve optimal mental health. Only by advocating for change will the health sector be able to benefit older people. Thank you for listening to my video presentation.